It is the evening shift at Riverside Residential Aged Care Facility. Some workers have called in sick, so staff numbers for the night shift will be minimal. Sue is the registered nurse on duty when the fire alarm sounds. Sue knows that every second counts, so she makes her way directly to the fire indicator panel. Firstly, Sue checks which fire zone is activated. The fire indicator panel is signalling Tuart Wing, room number 5. She cross-references this information with the fire zone plan to confirm the search area and room. Erin the carer arrives and Sue describes the area in alarm. Erin retrieves the fire extinguisher while Sue gathers the fire blanket and puts on the warden vest. As Sue and Erin make their way to Tuart Wing, they come across a closed fire door. Fire doors close automatically on a fire alarm to help create what's known as a fire-safe compartment, which keeps smoke and fire contained to a single wing or ward to provide safe refuge for residents and staff. Sue conducts a back-of-door check before proceeding through the fire door. Sue and Erin now search through Tuart Wing, looking for signs of smoke or fire. As they approach room 5, they detect a strong electrical smell in the vicinity. Erin knows she needs to do a thorough back-of-door check before entering the room. The back-of-door checking system is known as SHEES. Firstly, Erin looks for smoke at the bottom of the door and surrounding seal. She then runs her hand over the door to check for any radiated heat. An exposed wire touching the door handle or frame could pose an electrocution risk. Electricity causes muscles to contract, so Erin uses the back of her hand against the door handle to test for charge. Finally, she stands back and crouches low, using the wall to shield her from hot gases and smoke that may escape when the door is opened. If a door check indicates the presence of smoke or fire, it may not be safe to open the door. Remember, your safety always comes first. Erin carefully opens the door. A resident is still in the room and a burning television is rapidly filling the area with smoke. Sue and Erin know they need to apply the RACE procedure straight away. Erin prioritises the removal of the resident from the room. Elderly residents with dementia may become anxious and try to hide from fire, so Erin searches the cupboards, curtains and ensuite of room 5 to ensure no one else is left behind. Making a 000 call to the fire service as early as possible is crucial. Sue provides information to the 000 operator, including where the building is, who is involved, and what is causing the fire. The next task is to contain the smoke and fire. After a thorough sweep of the room and ensuite, Erin simply closes the door to minimise smoke entering the corridor. She then packs a towel at the base of the door to create a smoke seal and places the fire extinguisher in front of the door to assist with identification of the room involved with the fire. A typical fire service response time within the metropolitan area is 6 to 9 minutes. Sue and Erin's job is to get as many residents out of the fire compartment as possible, starting with residents closest to the room involved with the fire. A pillow or small item is placed in front of each closed door to indicate that the room has been searched and cleared. Sue clearly communicates to Erin where she would like the residents to be assembled. It is important that all staff are directed to a single rendezvous point in an adjoining fire-safe compartment or directly outside via an exit door. Finally, the group is assembled past the fire doors at a place of refuge. Sue conducts a roll call for the residents from Tuart Wing. Mrs. Brown is missing from the roll call, so Sue asks Erin to conduct a secondary sweep to recheck rooms and other areas such as linen cupboards. Meanwhile, the arriving fire officer receives a handover from the chief fire warden. They meet with Sue and ask for a situation report. Sue advises that all but one resident from Tuart Wing are accounted for, and that Erin is currently conducting a secondary sweep of the wing for Mrs. Brown. She confirms that a burning TV is causing severe smoke build-up in room 5, but the door is sealed off with a towel. The fire officer asks Sue for the location of the main electrical switchboard, main gas isolation valve, and the sprinkler control valve. Mrs. Brown has been found, and the fire service now takes control of the incident. If the building is deemed unsafe, staff will need to direct all residents to the emergency assembly area in the car park. Remember, anyone can assist in an aged care facility during a fire emergency, simply by being trained and competent with RACE. Remove, alert, contain, and evacuate.